The fluorescent lights hummed their mechanical hymn as Laura Bennett pushed through the double doors of St. Michael's Hospital, her badge clipped to navy scrubs that had been washed so many times the fabric moved like water against her skin. 7:15 in the morning. The ICU corridor stretched before her in its familiar geometry of beeping monitors and the faint antiseptic smell that never quite masked the underlying copper of blood and something darker, the scent of bodies fighting to stay alive. She'd worked these halls for 3 years. 3 years of steady hands, steady breath, steady composure even when Dr. Mercer moved through the unit like a man who owned it, who believed ownership came from the size of his paychecks and the network of referrals he controlled. Her locker was the same as it had always been, 3rd row from the top, corner unit, far enough from the main station that no one lingered when she opened it. Inside, hanging behind her spare shoes and the regulation scrub she kept folded in precise thirds, was a civilian jacket. Faded denim, the kind you could buy at any Target in America, unremarkable in every way except for the careful stitching along the lining where she'd sewn a unit patch before she left Tikrit for a life where her name meant nothing and her hands were just hands. The patch showed 4th Battalion colors, faded desert tan and marine red. She touched it once, a habit she'd developed over 1,095 days, and closed the locker without a sound. The ICU at shift change was a controlled chaos of handoffs and vital signs being reported from one nurse to the next. Charts moved between stations. For medications were verified twice. The machines beat their steady rhythm, the sound of oxygen saturation numbers climbing and falling like tiny hills on a monitor screen. Laura moved through it all with a kind of invisible efficiency that made her easy to forget. She didn't interrupt. She didn't ask questions. She showed up, performed her tasks with the precision of someone for whom precision was muscle memory, and disappeared into the background like she was made of the same recycled air that kept the machines running. That was exactly what Dr. Mercer wanted her to do. He was at the nurse's station when she arrived for her shift briefing, his white coat pressed hard enough to cut glass, his expression arranged in that particular configuration of authority that required no actual words to communicate. He was 38, maybe 40, with the kind of jawline that had probably worked in his favor once and the kind of eyes that had learned to look at people like they were problems to be solved or eliminated. His pen tapped against a file folder that had grown progressively thicker over the past 6 months, requisition forms, billing codes, equipment allocations that didn't quite match the supplies that had actually been ordered. Morning briefing in 5, he said to the assembled nursing staff, his voice the kind that made other people want to be somewhere else. Laura was already moving toward room for 12, where her first patient of the shift was waiting. She didn't need to be told twice. The unit comprised 12 beds in a semicircle arrangement, each one isolated by curtains that could be drawn for privacy or left open for continuous monitoring. Laura's assignment this morning included 3 patients, a post-operative cardiac patient in room for 08, an elderly man recovering from sepsis in room for 10, and in room for 12, Marcus Chen. The chart read like a military biography in medical shorthand: retired Navy SEAL, hearing loss secondary to blast trauma, Tikrit theater of operations, cognitive function intact, communication via written notes. His injury summary was clinical and impersonal, which meant it contained nothing about what IED blast actually meant in the context of a human body, what it felt like to have your hearing ripped away by concussive force while your mind stayed perfectly sharp enough to understand what you'd lost. She knocked on the door frame twice before entering, standard protocol, but also respect. Marcus looked up from the breakfast tray the aide had left, his eyes tracking her movement across the room with the awareness of someone trained to read what he couldn't hear in the world around him. He was maybe 55, shoulders still broad despite the hospital gown that hung loose on him now, hands steady on the fork like the only thing that had changed was the volume of the world. Laura opened the small whiteboard she kept clipped to her pocket and wrote in capital letters, "Good morning. How are you feeling?" She held it up and watched his eyes focus on the words before looking back at her face. He smiled, a real smile, not the practiced politeness that came from years of taking pity disguised as kindness. He picked up his own small whiteboard from the bedside table and wrote, "Better. Less dizzy." The handwriting was neat, military-trained, each letter deliberate. He showed her the board and she nodded, writing back, "That's good. Let's check your oxygen levels." She moved through her assessments with the efficiency of someone who had done this thousands of times. Pulse oximeter on his finger. Blood pressure cuff around his upper arm. The familiar squeeze and release of it. Heart rate at 78, regular rhythm, the kind of steady beat that belonged to a body that had learned how to survive. Oxygen saturation at 97%, which was exactly where it needed to be. She checked the fall line, clear fluid flowing steadily into his arm, no signs of infiltration or infection. She adjusted the flow rate slightly, documented the time and numbers on his chart, and looked back at him with a small nod. He was looking at her with an intensity that made something shift in her chest, and she couldn't quite figure out why. He picked up his whiteboard and wrote, more slowly this time, "You remind me of someone." He showed her the words and then seemed to think better of it, erasing them immediately. He wrote instead, "Thank you for taking care of Emmy." Laura wrote, "That's my job." She held it up so he could see, and she meant it literally and absolutely. That was exactly her job. No more, no less. She left him at 7:32 and moved to room for 10, where the elderly man with sepsis needed his antibiotics checked and his wound dressing changed. The smell hit her first, not unpleasant, just the particular chemical signature of Dakin solution and healing tissue. She had brought sterile gloves, tape, and fresh gauze. She'd brought the kind of focus that made pain manageable and made scared people feel slightly less scared. She changed the dressing while he talked about his grandchildren, and she listened the way people listened who understood that sometimes the talking was as important as the medication, that words were a kind of healing too. At 7:45, she passed Dr. Mercer in the corridor. He was on his phone, speaking in low tones to someone on the other end of the line. She heard fragments, allocation codes don't match. And, no one's auditing the supply orders. And, before the next cycle. She didn't slow down. She didn't acknowledge that she'd heard anything at all. She just moved past him like a ghost, like she was the kind of person who existed only in the spaces between important moments. But that wasn't the worst part. The worst part was that Dr. Mercer had seen her hear him, and the calculation in his eyes shifted into something that looked a lot like threat assessment. The kind of calculation that happened when a man realized someone had just become a problem instead of a resource. He watched her disappear into room 408 with the cardiac patient, and his hand tightened on his phone. His voice, when he continued his conversation, dropped even lower, and the tone changed from casual discussion to something else entirely. Something that sounded like strategy. Laura spent the next hour with her cardiac patient, a 62-year-old woman recovering from a triple bypass, still in that delicate window where the new grafts needed to be monitored for stability and the patient needed to be kept as calm as possible. She checked the cardiac monitor, watched the rhythm trace its steady pattern across the screen, and coached the woman through breathing exercises. In. Hold for 4. Out. The kind of rhythm that mimicked meditation, that taught the body how to be calm even when the heart had just been cracked open and sewn back together. The monitors beeped their steady song. Laura's hands moved through the familiar patterns of care, adjusting for drips, checking vital signs, documenting everything on the electronic chart that lived in the hospital's computer system and nowhere else. She worked the way she'd been trained to work in field conditions, moving fast but never rushed, precise but never hesitant. She worked like someone who understood that mistakes in medicine killed people, that negligence cost lives, that attention to detail wasn't just professionalism, it was survival. At 9:15, she took her break and sat in the break room with a cup of coffee that had probably been brewed sometime around 6 in the morning. The room was empty at this time of day, everyone else was still on shift, still moving through their assigned patients. She held the mug in both hands and let the warmth settle into her palms. For a moment, just a moment, her hands were still. The tremor that lived in them when she moved too fast, when adrenaline threatened to surface, was invisible. Coffee was warm. The break room was quiet. The world outside the window was just traffic and morning light. Then her phone buzzed. A text from a number she'd memorized but never saved, assets in position. The message disappeared as quickly as it had appeared, the way texts from certain numbers always did. She deleted it, held the phone until the screen went dark, and stood up. Her hands were steady again. They were always steady when they needed to be. At 9:37, she returned to the ICU. Marcus Chen was sleeping in room for 12, his breathing even, the monitors showing the kind of steady rhythm that meant his body was healing the way it was supposed to. She checked his IV without waking him. She logged her observations into the computer. She made a note in the chart, patient resting comfortably. Vital signs stable. Continue current protocol. All of it was true. All of it was exactly the kind of documentation that made Dr. Mercer's paperwork fit into the system like it belonged there. She didn't yet understand that she was standing at the edge of something that would change everything, that the man sleeping peacefully in the hospital bed next to her had a name tattooed on his forearm that would matter more than his own survival, that Dr. Mercer's phone calls about billing codes were the first threads of something that would eventually unravel his entire career. She was just a nurse, doing her job, keeping her head down, moving through her shift the way she'd been moving through her life for 3 years, invisible, competent, impossible to see. But she was being watched. And the watching was about to become something else entirely. The watching was about to become something else entirely. Dr. Mercer's gaze had shifted from casual observation to calculated measurement, the way a surgeon sizes up tissue before cutting. Laura first understood this during afternoon rounds in room for 47. The elderly man there, 73, post-cardiac surgery, his daughter and son-in-law maintaining vigil beside his bed like sentries. Laura had checked the medication schedule twice that morning, cross-referenced the pharmacy orders, verified the protocol window. The morphine drip was due at 1400 hours. She administered it at exactly 1400, the syringe steady in her hand as the medication flowed through the IV line. At 1403, Dr. Mercer entered. "Nurse Bennett." His voice carried the precise tone of a prosecuting attorney identifying evidence. "Again?" He picked up the chart with theatrical slowness, his eyes moving across the page as though reading a confession. The fluorescent light above the bed cast his shadow across the patient's chest like a blade. This medication was due at 1400. It is now 1403. Do you understand that 3 minutes of delay with cardiac patients can mean the difference between recovery and complications? His voice didn't rise. It never did. That was what made it worse, the absolute certainty beneath it, the voice of someone who knew he couldn't be contradicted. Laura's jaw tightened fractionally. Muscle memory from years of discipline, from situations where showing emotion meant operational compromise. She kept her voice level, each word measured like a dose. "Doctor, the protocol window is plus or minus 5 minutes for this dosage. I administered at 1400 on the mark." Mercer turned to the family with a weary smile, the smile of a man bearing an unbearable burden. "You see what we deal with? Nurses who think they know better than the physicians who actually went to medical school." He set the chart down with deliberate gentleness. "Perhaps our little Florence Nightingale here needs remedial training on following orders." The daughter's face flushed. Her son-in-law's expression shifted into something between doubt and defensiveness. Laura completed her notation in the chart, her pen moving with absolute precision. She did not look up. She did not defend herself. She simply finished the entry, recapped her pen, and left the room with measured steps. It wasn't until she reached the stairwell that her hands moved. She gripped the metal railing, feeling the cool steel press against her palms. The trembling that came, it wasn't fear. It was the physical manifestation of restraint, the kind that comes from holding back a response that would have ended the conversation permanently. She breathed through it, counted backward from 10 in the darkness of the landing, and when she descended back to the unit, her hands were steady again. The break room unfolded 2 days later like a choreographed abandonment. Laura entered at 1245 hours, her lunch bag in hand, and found the usual contingent gathered around the center table. Jamie from oncology, Marcus from emergency surgery, 2 nurses from night shift lingering past their shift end, all of them mid-conversation about a new admissions protocol. The room smelled of microwaved chicken and burnt coffee. Laura pulled out a chair at her usual corner spot, the seat she'd occupied for 3 years, the one with the slightly loose leg and the view of the motivational poster about teamwork. She'd sat down for approximately 8 seconds. Jamie stood abruptly, gathering her things with the precision of someone executing a predetermined plan. "Oh, I just remembered. I have to check on Mr. Patterson before I leave," promised his daughter-eyed. She didn't finish the sentence. Within 30 seconds, the room had emptied. Lunch bags grabbed mid-bite. Coffee abandoned, still steaming in mugs. The sound of their departures, rubber-soled shoes moving with sudden urgency, the soft thud of the break room door closing, filled the silence they left behind. Laura sat alone with her unopened sandwich and the electric hum of the refrigerator. She took one bite, chewed it mechanically, and stared at the motivational poster. A group of hands arranged in a circle, all different colors, all united. "Together we rise," the text proclaimed in aggressive sans serif. Her expression never changed. Her hands remained on the table. Somewhere in the corridor outside, she could hear the faint beeping of a monitor, the distant voice of Dr. Mercer calling out orders to a medical resident. She finished her lunch alone, rinsed her container, and returned to her rounds with the same composure with which she might have returned to a combat position after intelligence indicated enemy movement. Facts were facts. Isolation was a tactic as old as hierarchy. She'd survived worse. The unit board came on Friday afternoon. Laura arrived for her shift at 14:30 and found the staff gathered in a loose semicircle around the bulletin board beside the nurse's station. Their posture, that particular tension in their shoulders, told her before she saw the documents themselves. Dr. Mercer had posted disciplinary write-ups. 3 of them. Her name highlighted in red marker on each page, glowing like a warning beacon against the white paper. Bennett, medication timing deviation. Bennett, failure to notify physician of minor status change. Bennett, insubordinate tone in physician consultation. The handwriting was his, precise, clinical, damning. Mercer stood approximately 8 feet away, speaking with 2 other physicians. His voice carried perfectly, that weapon of his reaching the entire unit without apparent effort. Some people simply aren't cut out for the rigor of acute care. Excellent at routine tasks, perhaps. But when complications arise, when split-second decisions determine outcomes, some individuals simply lack the necessary judgment. He paused, turning a page of one of the write-ups as if making a point. "I'd hate to see a preventable error end up on her license, but if the pattern continues, I have a professional obligation to escalate to the credentialing committee." Laura moved past the board. She didn't stop, didn't pause, didn't allow her eyes to linger on her own name highlighted in accusatory red. She retrieved her assignment sheet from the inbox, noted her patient roster, and began her rounds with the same efficiency she brought to every task. Her face was stone. Absolutely stone. But in the supply closet 30 minutes later, standing before the rows of syringes and gauze packs and 4 lines, her hand froze. Just for a moment. Her fingers hovered above the shelf containing the 14-gauge angiocath needles, and something in her chest tightened. She saw it clearly then, the full structure of it. The public humiliation in room for 47 designed to undermine her credibility with patients' families. The break room isolation designed to cut her off from collegial support. The red highlighted documents designed to create a paper trail that would support any action he decided to take next. It was competent. Calculated. Systematic. Her hand steadied. She forced it to move, continued her inventory count aloud, 17 needles, 18, 19, her voice steady in the supply closet's fluorescent-lit silence. By the time she emerged, her breathing had returned to normal. Her expression had returned to neutral. She was ready for whatever came next, though she didn't yet understand that the trap was already closing around someone else, that Dr. Mercer's true target wasn't her continued employment but something far more specific, far more dangerous. That evening, she received notice that Marcus Chen, the deaf Navy SEAL who'd been admitted 5 days prior, recovering from post-surgical monitoring, was being permanently transferred to her section. The scheduling change came through at 1900 hours, signed by Dr. Mercer himself. Laura read it and understood immediately. He wasn't trying to remove her anymore. He was setting conditions. Giving her a patient to care for, monitoring whether she'd slip up, documenting every decision, building the architecture of failure one notation at a time. She accessed Chen's chart on the computer terminal and found new orders appended. Additional imaging studies. An extended medication protocol. Procedures that seemed medically unnecessary but were perfectly justifiable in documentation. Each one another billing opportunity. Each one another layer in whatever was being constructed. That night, in the privacy of the staff bathroom, Laura photographed the orders with her phone. Her hands were completely steady, even as the implication settled cold and certain in her chest. This wasn't about her clinical competence anymore. This was about evidence. This was about the moment when she finally understood that staying silent wasn't restraint. It was complicity. And staying silent was no longer an option. The evening shift settled into its rhythm around 1830, the kind of measured pace that precedes disaster without anyone knowing it. Laura moved between her for patients with the efficiency of someone who'd learned long ago that wasted motion costs lives. Room for 12 held an elderly man post-appendectomy, stable and sleeping. Room for 14 contained a diabetic woman waiting for endocrinology consult. Room for 16 was empty, prepped for admissions. And room for 18 held Marcus Chen, the retired Navy SEAL whose chart documented only that he was deaf, that he'd survived an IED blast in Tikrit 14 years ago, that his hearing loss was bilateral and permanent. What the chart didn't say was that he watched Laura with the quiet intelligence of someone trained to read situations without sound, that his left hand sometimes moved in patterns that looked almost like signing, that somewhere in his medical history was a name, Bennett, that meant survival. Laura had first noticed the change during evening vitals at 17:45. Marcus Chen's oxygen saturation read 98% on 2 liters via nasal cannula, perfectly normal. By 1815 it had drifted to 96. By 1845, 94. A slow decline that could mean nothing or everything. She sat at the edge of his bed with her penlight, watching his chest rise and fall, timing his respirations against the clock on the wall. 22 breaths per minute. Normal range was 12 to 20. He was working harder to breathe, though his face remained calm, unmarked by the anxiety that usually accompanies oxygen starvation. She documented the trend in his chart. O2 sat declining from baseline. Increased respiratory rate. Breath sounds clear bilaterally. No acute distress noted on exam. That last sentence was the careful language of a nurse covering herself. No acute distress. Meaning, nothing visible yet. But something was happening. She could feel it the way soldiers feel a shift in air pressure before a storm, a change in the atmospheric weight of a room, a sense that the equilibrium had tipped and was moving toward a cliff. She increased his supplemental oxygen to 3 liters and set the monitor to alert at anything below 90% saturation. "I'm just adding a little oxygen," she told him in writing on the whiteboard they kept at his bedside, the communication method they'd established over his hospital stay. "You'll feel better." He nodded, trusting her completely, and that trust felt like weight pressing against her sternum. She checked the monitor every 3 minutes, the way a mother checks a sleeping infant for breath. 98. 97. 95. By 1910, it had settled at 92% and wasn't climbing despite the increased flow. Dr. Mercer arrived for evening rounds at 1925, his stethoscope draped across his shoulders like a weapon. Laura intercepted him at the nurse's station, her voice level and professional. "Mr. Chen in 418. Oxygen saturation trending down since 1745. Started at 98, now 92 despite increased supplemental oxygen. Respiratory rate elevated at 22. She handed him the chart, her words precise and stripped of any emotion that might be read as panic or overreach. Mercer scanned the vitals without looking up. "How is he symptomatic?" "No distress currently noted." "But the trend?" "The trend," Mercer interrupted, "is often the product of an overzealous nurse misinterpreting normal patient fluctuation as pathology." He closed the chart and handed it back. "Continue current oxygen therapy. I will evaluate during morning rounds." He turned away, already moving toward the next room, and Laura felt the familiar compression of her throat, the feeling she'd learned to recognize as rage that couldn't show, anger that had to calcify into granite in her chest or risk everything. She didn't respond. Didn't defend the observation. Didn't push. That was the lesson Mercer had taught her over 3 months: push, and you disappear. Question his judgment, and he makes the process painful. Stay silent, and you maintain the delicate fiction that she was nothing more than competent but expendable. She returned to Marcus Chen's room and smiled at him through the tightness in her jaw. Wrote on the board, "Doctor says keep watching. You're doing great." Night shift officially began at 7 p.m., though the transition was seamless, one set of nurses replacing another in the careful choreography of hospital handoff. Laura's assignment held, for patients, including Marcus Chen. She'd be monitoring him alone for the next 8 hours with only the charge nurse available for backup, a nurse named Patricia who was covering 10 beds on the opposite side of the floor and who had the distinct impression that Laura Bennett was the type who could handle her own emergencies. Which was the problem? That reputation meant no one came unless she called, and calling meant using the rapid response team, which meant directly contradicting Dr. Mercer's explicit orders. By 2030, Marcus Chen's oxygen saturation had drifted to 91%. His respiratory rate had climbed to 24. Laura increased monitoring to every 10 minutes, standing at his bedside in the darkened room and listening to his lungs with her stethoscope, a ritual that had become meditative, the act of hearing what machines might miss. The left side sounded like wind through a damaged building, diminished, hollow. His jugular vein seemed slightly distended, the kind of subtle change that might be nothing or might be the first sign that pressure was building in his chest cavity where it had no right to be. Tension pneumothorax. Lung collapse. Air entering the space between the visceral and parietal pleura, compressing the heart and great vessels millimeter by millimeter. A condition that killed silently until it killed violently. She paged Mercer at 2013. Patient Chen room 418. Decreased lung sounds left side. Possible pneumothorax. Requesting immediate evaluation. 20 minutes. No response. She paged again at 2110. Patient Chen showing respiratory distress. Left-sided breath sound severely diminished. Please advise. The response came via text message to the unit phone, the words appearing in that cold blue glow that meant everything wrong about how this would play out. Nurse Bennett, stop creating emergencies to justify your hypervigilance. Continue current treatment plan. I will evaluate in the morning. It was calculated cruelty wrapped in medical language. Hypervigilance. As if her ability to recognize early deterioration was a psychological defect rather than a survival skill honed in places where hypervigilance meant the difference between going home and being shipped home in a flag-folded box. Laura set the phone down on the desk with the kind of care usually reserved for explosives. Her jaw clenched so hard she thought her teeth might crack. Around her, the hospital moved through its night rhythm, code call overhead in a distant wing, the beep of monitors, someone's call light dinging softly. The fluorescent lights cast everything in that sickly yellow tone that made normal skin look necrotic. She could have paged the attending physician directly, could have gone around Mercer, could have activated the rapid response team on her own authority. But doing so would be documented in writing, would become insubordination, would give Mercer the exact ammunition he needed. She'd seen it happen to another nurse 2 years ago, challenged a doctor's order, saved the patient's life, got fired anyway because the structure protected its own first. So she returned to Marcus Chen's room, where he was now breathing with visible effort, his shoulders rising and falling in a rhythm that belonged to something desperate rather than sleeping. She increased his monitoring to every 15 minutes and positioned a crash cart just outside his door, close enough to be useful, far enough to look casual. She pulled a chair to his bedside and sat where she could watch both his chest and the monitor simultaneously. The oxygen saturation read 89% now. His respiratory rate had climbed to 28. The numbers were moving in the wrong direction, moving toward the edge of the cliff. She wrote on the whiteboard with careful penmanship, "I'm watching you tonight. You're safe." Marcus Chen gave a thumbs up, complete trust, and Laura felt something crack inside her, not visibly, not audibly, but internally, like a load-bearing wall developing a hairline fracture. He had no idea that his lung was collapsing. He had no idea that his former medic was sitting 3 feet away, calculating risks and career trajectories and the mathematics of choosing between orders and conscience. He had no idea that somewhere in his service record was a name that would have meant something to this woman, would have changed everything if he could have seen her clearly through the blood and smoke. The night deepened into that strange quiet that hospitals specialized in, not peaceful, but the quiet before action, the held breath before something breaks. Laura moved through the motions of her other patients with half her attention, her primary focus locked on the monitor in room for 18 and the vital signs scrolling across the screen like a countdown. 90. 89. 88. The saturation dropped another point every 10 to 15 minutes, a remorseless mathematical progression toward a threshold. She knew the threshold. Anything below 85% and his brain would begin to suffer hypoxia. Anything below 80 and permanent damage became possible. Anything below 70 and the organs began to shut down in the silent cascade that looked peaceful but was cellular devastation. At 23:36, she sat at the nurse's station with her hand hovering over the rapid response button. The call button that would activate a team, would bypass Dr. Mercer's authority, would save Marcus Chen's life and end her career. She'd made similar calculations in Tikrit, sitting in the dark with radio chatter and rules of engagement that said wait, and the knowledge that waiting meant dying. She'd calculated then too, what was worth losing. The answer had always been the same. Everything was worth it if the outcome was someone going home. At 23:58, Marcus Chen's oxygen saturation hit 87% and his respiratory rate spiked to 32, his whole body moving with the effort of breathing, and Laura stood. The decision was made the way decisions are made in combat, not with thought but with reflex, the instinct that knows what needs doing regardless of the cost. She walked toward his room carrying the crash cart, her movements quiet and economical, and what happened in the next 10 minutes would change everything, again. Marcus Chen's oxygen saturation was dropping like a stone. 84%. 82. The numbers glowed on the monitor in merciless red as Laura stood frozen for exactly 1 second in the doorway of his room, reading the disaster unfolding before her. His chest wall heaved with the desperate work of a body drowning in air. The left side of his thorax bulged outward, hyperinflated, rigid as stone. His trachea had shifted visibly to the right, the midline deviation of someone whose lungs were collapsing from the inside. His lips had taken on a blue tint. His eyes, usually clear and patient, were wide with the animal knowledge of someone suffocating. Tension pneumothorax. Collapsed lung with air trapped in the pleural space, pressure building, compressing the opposite lung, pushing his heart sideways in his chest cavity. Minutes to cardiac arrest. Possibly less. Laura hit the code button as she moved, her hands already reaching for the crash cart, muscle memory taking over the way it had in a tent outside Tikrit with mortars landing 30 meters out. 78% saturation. The monitor's rhythm was tachycardic, racing. She didn't wait for the code team, 3 floors away, maybe 90 seconds out, which was 90 seconds too late. She positioned Marcus flat on his back, located the second intercostal space at the midclavicular line with the precision of someone who'd done this in the dark with sand in her eyes. Her fingers found the ridge of his ribs, counted down, found the space. Alcohol swab. The smell of it sharp and clinical. Her hands moved the way hands move when they've rehearsed something 10,000 times under every condition imaginable. 14-gauge catheter from the crash cart. She held it perpendicular to his chest wall, took a breath that no one watching could have heard, and pressed. The resistance changed almost imperceptibly. She felt it rather than heard it, the distinct pop of the needle punching through the parietal pleura into the pleural space. Then the sound every emergency provider lived for, the hiss of trapped air escaping, a sound like someone releasing the pressure valve on a steam pipe, immediate and undeniable. The air that had been compressing his lungs now had somewhere to go. Marcus's chest wall relaxed visibly. His trachea shifted back toward midline. His shoulders dropped an inch. The monitor began its climb almost immediately, 85, 87, 90. His color returned from blue-gray to something approaching human. His breathing shifted from the frantic gasping of drowning to something deeper, more controlled. He looked at Laura and managed to nod, his eyes saying thank you in a language that required no words at all. The code team arrived 30 seconds later, resident first, followed by the charge nurse and 2 technicians. The resident took in the scene, the catheter in place, the monitor climbing, Marcus breathing, the sharps container with the used needle, Laura standing calmly with her gloves off, and something in his expression shifted from crisis mode to confusion. His mouth opened. Closed. He was looking at Laura the way people look at someone who has just done something that shouldn't have been possible. Jesus Christ, who did the decompression? His voice was barely above a whisper. Laura was already moving toward the sink, washing her hands with the economy of someone who'd done this 10,000 times before this night and would do it 10,000 times after, if there was an after. She spoke without turning around, her voice steady as a surgeon's hand. Patient was dying. I stabilized him. Probable tension pneumothorax, needle decompression second intercostal space mid-clavicular line. He needs a chest tube now and imaging to confirm. Full left-sided collapse, likely from the underlying pathology his surgeon was evaluating. The resident nodded, processing, already moving into physician mode. Orders began flowing. The team moved into the practiced choreography of crisis response, and Laura stepped back, her job done, her violation complete. But that wasn't the worst part. Dr. Mercer arrived 15 minutes later, drawn by the code alert, his face already arranged in an expression of mild annoyance at the disruption to his night. He surveyed the room with the quick assessment of someone accustomed to walking into crises and bending them to his will. Marcus was stable. Breathing. Monitor showing normal sinus rhythm at a reasonable rate. The resident was ordering a stat chest tube. Everything that should have happened in the crisis of a tension pneumothorax had happened. Then Mercer's eyes found Laura standing against the wall, watching, and something shifted in his expression. Not gratitude. Not acknowledgement. Something colder. Calculation. He turned to the charge nurse, his voice carrying the weight of someone accustomed to being obeyed. Nurse Bennett performed a physician-level procedure without authorization. Document it as a protocol violation. I want a formal report on my desk by morning. His eyes found Laura's for exactly 1 second. You're finished here. Return to your other patients. We'll discuss this later. Laura met his gaze without flinching. She said nothing. She simply nodded, a gesture so minimal it was almost imperceptible, and turned to leave the room. Her composure held like reinforced concrete. Her jaw tightened fractionally. But her hands were steady, her breathing unchanged, her face a mask of professional detachment. She walked out of his room and returned to her remaining patients as if she hadn't just become a threat that needed eliminating before the next audit cycle. She didn't see Mercer reach for his phone before he'd even left Marcus's room. She didn't know that by 2:36 in the morning, he'd made 3 carefully worded calls to board members whose referral patterns depended on his continued goodwill, framing her intervention as dangerous overreach by a nurse with a documented history of not following orders, a liability exposure that needed containment. She didn't know that by 4:30 he'd contacted someone at the state nursing board, feeding carefully worded allegations into channels where words had weight, pattern of exceeding scope of practice, unsupervised procedures, patient safety concerns masked by heroic narratives. She didn't know that by 6 o'clock, he'd already brought in an outside consultant, a retired hospital administrator who owed him a favor and who'd be paid in future referrals, to review her personnel file and provide an independent assessment of her suitability for continued employment. The consultant's report was drafted by 7:15, each word chosen with surgical precision, recommendation for immediate termination to prevent liability exposure, precedent for future incidents, failure to respect chain of command. At 8 o'clock, as the morning shift arrived and the night dissolved into paperwork and handoffs, Laura was pulled from her rounds by the charge nurse. A quiet word. A gesture toward administration. She didn't resist. She walked down the corridor toward the HR office the way someone walks toward an ending they've already seen coming. The HR director avoided her eyes throughout the recitation of the termination notice. Effective immediately. Violation of protocols. Patient safety concerns. 15 minutes to collect personal items. Security would escort her. Standard procedure. Laura listened without interrupting, without defending herself, without even asking questions. She already knew how this would end. She'd been trained to accept orders from people with authority over her. That instinct didn't disappear because she'd been a ghost for 7 years. Security walked her to her locker at 8:20. She retrieved her personal items, a picture of her mother from 15 years ago, a book she'd been reading, a sweatshirt she'd left in case of late shifts. And the jacket. The faded blue jacket with navy insignia so worn the lettering was barely visible, its lining carefully stitched with a unit patch from 4th Battalion, the designation she wasn't supposed to acknowledge, the identity she wasn't supposed to claim. She held it against her chest like someone holding an artifact from another life. The walk to the parking lot was exactly as long as it felt. Mercer watched from the 3rd-floor window, his expression satisfied the way expressions become when an obstacle has been removed. She could feel his eyes on her back. She didn't turn around. She sat in her car for 10 minutes without moving, the keys resting in her lap, the jacket folded carefully on the passenger seat. The morning was already heating up. The parking lot was filling with arriving staff. People who would walk past her without knowing they'd just lost the person who would have been there if they ever needed her. She started the engine. She drove without a destination. By 11:53 a.m., she was sitting in the corner booth of an all-night diner on Military Highway, the kind of place that served people at all hours without questions, without judgment. At 1 p.m., the waitress refilled her coffee for the 6th time, and Laura sat staring at her reflection in the dark window of the booth. The fluorescent lights made her look hollow. Older. Like someone who'd been erased from the inside out. She'd been ordered to disappear after Tikrit, told that the extraction operation was classified beyond recovery, that her service record would be scrubbed from any official system, her decoration sealed in files that didn't exist, that surfacing would compromise operations still active in theaters where people she'd trained were still operating. She'd honored that silence for 7 years. Built a new life as a ghost. Built a career as a nurse, a real one. She'd been good at it, had been saving people every single shift without anyone knowing what she'd already saved. And now she wondered if erasing herself had been survival or just a slower kind of dying. The phone on the table in front of her was dark. No messages. No one to call. The waitress recognized the look, recognized it because she'd seen it before in other people at other hours, the look of someone at the bottom of a fall with no ladder in sight. But that wasn't the ending. That was the pause before everything changed. By 8:20, the badge was already gone. Security had walked her to the parking lot with a manila envelope containing her final paycheck, her jaw tight but steady as they collected her ID and access card. Laura didn't flinch. She'd survived worse than humiliation, she'd survived Tikrit. What stung wasn't the firing itself, it was knowing Marcus Chen was still in the hospital bed, still breathing because of her, while the man who'd tried to destroy her for saving a life walked those corridors like he owned them. She sat in her car for exactly 7 minutes, hands gripping the steering wheel, watching the morning shift arrive through the glass entrance. Doctors in white coats. Nurses with fresh badges. The machinery of St. Michael's continuing without her, as if the last 3 years had been erased with the swipe of a keycard. At 1 p.m. hours, 5 hours after termination, Laura returned to collect her final paycheck in person. She'd learned long ago that disappearing completely was a mistake. It left gaps. It left questions. It left patterns. The lobby of St. Michael's should have been quiet on a Wednesday afternoon, the kind of controlled chaos that comes from routine, admissions checking in patients, discharge planners reviewing charts, the intercom crackling with overhead pages. But as Laura pushed through the glass doors, the entire atmosphere changed. Security personnel stood at controlled intervals, not hospital security, she recognized immediately. Federal bearing. Military posture. The lobby had become a staging ground. At the center, surrounded by guards in unmarked vests, was a gurney. On the gurney lay a man, Middle Eastern features, eyes scanning the room with the kind of assessment that only came from combat training. As the gurney wheeled past, the man's gaze locked onto Laura. His entire body went rigid. He shouted something in rapid Arabic, his voice raw with emotion, and then, quieter, more urgent, Kernafila. The call sign. Her call sign. The name she'd been told to forget, buried with a classified operation in a city that officially she'd never visited. Laura's breath caught, but she didn't move. Didn't run. Didn't react. The composure held like a dam against water pressure. A Marine officer in dress blue stepped forward from the security detail, a document folder in his hands. His eyes found Laura and he moved toward her with the kind of deliberate precision that meant this encounter had been planned. Captain Laura Bennett. His voice was respectful, but it wasn't a question. He opened the folder and turned it so she could read the citation. Silver Star. Classified Operations. Naval Special Warfare. Her service record, the one that was supposed to stay sealed, now exposed in a hospital lobby in Norfolk like classified documents at a security checkpoint. The room went so quiet you could hear the fluorescent lights hum, a sound like electricity pushed through copper wire, like systems recognizing a threat they'd been trained to acknowledge but never speak about. People stopped moving. Nurses at the desk paused mid-keystroke. A doctor checking the admission screen turned slowly, piecing together what the presence of federal security and formal citations meant. Then a two-star general walked through the main entrance. The room compressed, oxygen displaced by hierarchy. The general's eyes found Laura immediately, and without hesitation, without the slightest doubt about her identity, he rendered a formal salute. His hand came up to his brow with the precision of a man who had rendered that salute to presidents and fallen soldiers, and now he was rendering it to a woman in civilian clothes standing in a hospital lobby. She'd kept her composure through 3 years of humiliation, through having her medical judgment questioned, through accepting termination with a steady hand. But watching the general's salute, watching the recognition in his eyes, Laura felt something shift. The dam cracked. She returned the salute, her arm rising slow and controlled, her expression unreadable, but every muscle in her body knew what that gesture meant. She wasn't erased. She was seen. She was still a captain. Dr. Mercer pushed through the crowd, his white coat flaring behind him like a cape about to catch fire. What is the meaning of this? His voice was sharp, accustomed to authority, to being the most important person in every room. The general turned toward him with the kind of patience that comes from rank so absolute it didn't require raised volume. Your hospital received a federal inquiry regarding a personnel termination this morning. We're here to clarify matters of national security. Captain Bennett's service record is classified. Your investigation into her conduct will require Pentagon verification. The word captain hung in the air like a grenade with the pin pulled. Mercer's face drained of color, not confusion exactly, but recognition that he'd triggered something far larger than a disgruntled nurse's complaint. He'd made calls to board members. He'd activated his network. He'd done what he always did, weaponized his position and his favors. But he'd done it against someone who didn't exist on the institutional charts he understood. The Pentagon verification took 48 hours. Laura was placed on administrative leave pending the inquiry, which meant she sat in her apartment in Norfolk while federal investigators moved through St. Michael's like sharks detecting blood in water. The verification came back with her code name attached, Kernafila, and with it came a formal request for clarification on why the inquiry had originated from the hospital in the first place. That request was classified as federal obstruction. An audit was triggered. A real audit. The kind with subpoena power and forensic accountants who looked at systems the way surgeons looked at tissue, precise, unforgiving, designed to find what shouldn't be there. What they found made the phantom consultations look like rounding errors. 8 years of billing fraud. Consultations billed by Dr. Mercer to military insurance programs for patients he'd never evaluated. Surgical equipment costs inflated by 40% with kickback arrangements from suppliers, documents signed in his careful handwriting, approval codes he'd falsified, dates he'd doctored. Procedures extended on military patients whose complex insurance made oversight nearly impossible, each extra day billed as medically necessary when the records told a different story. The board members Mercer had called, the ones who owed him referral favors, distanced themselves with the speed of men watching a building collapse. Their phone calls stopped. Their email responses became formal and brief. The referral relationships that had sustained his practice for 15 years were suddenly never mentioned. The outside consultant brought in to review Laura's file was interviewed by federal agents and provided documentation that made everything worse: Mercer's explicit instructions to fabricate a termination justification, emails detailing the strategy, conversations recorded during compliance meetings. The consultant turned witness to save his own license, and in doing so, sealed Mercer's. The state nursing board contact received a courtesy call from a Navy legal officer explaining that the allegations against Captain Bennett involved classified service matters, and any disciplinary action would constitute federal obstruction. The complaint was withdrawn within 60 minutes. Mercer's attorney advised immediate resignation before criminal charges were filed. He sat across a desk in a borrowed suit, not his usual tailored silk, but something off the rack from a discount chain, and listened to a prosecutor explain the counts: 8 years of fraud, falsification of records, patient endangerment through unnecessary procedures. His medical license was suspended by the state board pending criminal investigation. His hospital privileges revoked. His malpractice insurance dropped him via certified letter. The final hearing before the state medical board was procedural, formality over substance. Mercer sat in that borrowed suit looking somehow smaller than he'd ever been in a white coat as they read the findings. Gross negligence. Fraudulent billing. Patient endangerment. Falsification of personnel records. His license was permanently revoked. The professional death was immediate and complete. 6 months later, someone forwarded Laura a photograph with no message attached. Dr. Mercer in a community college classroom, teaching CPR basics to a handful of disinterested students, a whiteboard behind him with crude diagrams of chest compressions, his expression weary and defeated. The course catalog visible in the corner listed the position at $17 per hour. Laura stared at the photo for exactly 30 seconds, her face unreadable, then deleted it without saving, without forwarding, without comment. Revenge is empty calories, and she was hungry for something else entirely. The rest of her life, or at least the part that belonged to her again, began at the Hampton VA hospital, where her service record wasn't a secret that needed burying but an asset that meant something. Where the things she'd learned in Tikrit, the things she'd carried in her chest for 8 years, could finally be used for something other than survival. Her badge now read Captain Bennett, no longer needing the pretense of anonymous competence. The fluorescent lights over her station buzzed the same familiar rhythm as every hospital in America, but here, people knew what she'd done. People understood what her composure meant. On her first week, walking through the rehabilitation wing, Laura saw him. Marcus Chen in the occupational therapy room, working with a sign language instructor, his hands moving through basic signs with concentration, frustration, and something that looked like hope. She watched from the doorway until his therapist noticed and waved her in. Marcus looked up, and his face lit with recognition, not of her face, but of the faded 4th Battalion unit patch she'd pinned to her new VA identification lanyard. The patch retrieved from inside her jacket lining, the one that had traveled 8 years sealed in fabric, waiting. She'd been told to erase herself. She'd honored that silence. But some things refused to stay hidden. She approached slowly, and her voice when she spoke was steady. "You made it home." Marcus's therapist interpreted as Marcus signed a question, watching Laura's lips. Laura pulled out her phone and typed, "I was the medic in Tikrit. My call sign was Kernafila. I was the one who carried you to the extraction point." Marcus read it 3 times. His hand started to shake. He pointed to the Bennett tattoo on his forearm, looked at her name tag, looked at her face. When his therapist's voice cracked translating his signs, Laura finally understood. "He's been looking for you for 8 years. He was told you died in a helicopter crash." Laura sat down heavily across from him, and for the first time in 8 years, her composure finally broke. Tears ran unchecked down her face, and Marcus reached across the space between them to grip her hand fierce and true. They sat like that while the world reorganized itself into something that made sense again. If you found this story powerful, subscribe for more tales of hidden heroes and justice delayed but never denied. Like this video to help other people discover the incredible strength of those who serve quietly, and comment, have you ever been underestimated by someone who didn't know your true value?